Hi, Dr. Showcare. One question we get when it comes to body recontouring is what are the different types of tummy tucks, or our term abdominoplasties, that are available. I'm going to try and give you the three that we discuss the most with our patients. The first is the least invasive and one that allows for a recovery that's basically like liposuction or suction-assisted lipectomy. And that is a mini tummy tuck, the term that we use. And that means that we're performing liposuction of the entire abdominal area, hip and flank, to reduce the overall volume of the entire mid-trunk. And then we're taking a very small piece of skin out in the lower abdomen because we feel like in most patients who've had perhaps children or genetically have a little looseness, it helps the skin redrape in the lower abdomen. So the recovery is really just like liposuction, but you're still hedging your bet in the lower abdomen by taking a little skin out. So the recovery is typically 3 to 4 days. Usually patients are up doing most everything they want within 24 hours and back to the work environment in 3 to 4 days. The second option is exactly what I mentioned with the mini tummy tuck, but you also tighten the abdominal muscles from the belly button down. There's not many patients who really qualify for the true mini tummy tuck because most patients have abdominal looseness that extends from the pubic area all the way up to the breastbone, and those patients need a full tummy tuck. So first we have the mini tummy tuck where there's no muscle tightened, no muscle work is done, so the recovery is again like liposuction. A mini tummy tuck where we do everything a mini tummy tuck does, except we also tighten the muscle from the belly button down, and there's no incision around the belly button for either one of those. And then there's the full abdominoplasty or full tummy tuck, which again in our practice always includes liposuction of the entire trunk all the way around, but we also cut around the belly button to free it and leave it on a stalk that comes from the abdominal wall. Lift all the skin, pull all the skin down, take a much larger segment of skin out because it's necessary, and tighten the muscles. And that will recontour the entire abdominal wall. And an example of a full tummy tuck that can have significant results is someone like this, who basically lost 4 dress sizes or pant sizes. And you can see that the entire mid-trunk is contoured, and this is basically a year later. And you can see that this is a permanent change and a significant change, but again, at least a 2-week recovery when you tighten the muscles and you do this much work. So I hope those options, the mini tummy tuck, the mini tummy tuck, or a full tummy tuck, are now a little clearer.